Hello and welcome to my YouTube channel. If you're new to this channel, welcome. In this channel, we try to educate the public on common health conditions and a lot of other things. If you are a returning subscriber, thank you for the support. Thank you for the massive support. For those that have been watching my videos, liking, sharing, I appreciate you all. I want you to know that I appreciate you all. In this video, it's a continuation of the last video where we talked about diabetes mellitus. We already said that diabetes mellitus is a very common condition, very common in a way that you might be related to someone that is diabetic, or you yourself might be diabetic, or you might have friends that are diabetic, in-laws that are diabetic. So it is very common, and it affects both the young and the old as well. Last time we talked about types, type 1, type 2, and gestational diabetes. In this video, we want to look at the symptoms, what you find in people that are diabetic. We want to look at the causes, what causes type 1, what causes type 2, what is responsible for someone becoming diabetic. Then we also want to look at management. What would you do, or how would you manage diabetics? How would you live with diabetes? What can you do in your own small way, or what can you do to reduce your chances of coming down with diabetes? So we'll be looking at these top headings in this video. Thank you very much. Stay tuned. So if this is your first time on this channel, I'll suggest you watch the previous video. That is an introduction to this video. I've linked it up here. For this video, let's talk about the symptoms in type 1 diabetes mellitus. These patients might present to the hospital at a very young age, maybe in their teens, or or earlier than that. They can present that young, and they present with most times symptoms like weight loss. They present with polyuria. They present with polydipsia. They can also present with polyphagia. I'll explain this. In type 2, these are the usual symptoms they also present with. It is very common in all types of diabetes, but in type 2, they don't have weight loss. They are usually at the opposite end. They have weight gain. They are usually obese or overweight, and you see that but it doesn't stop them from eating. They eat, they drink a lot, they urinate a lot. That is what we call polyuria. Polyuria is passing a lot of urine. They're always going to urinate frequent urination during the day and at night as well. And polydipsia means they are always, because of the loss of fluid, if you are urinating, they also take a lot of, they are always thirsty, so they drink a lot of water. They're always thirsty. That's polydipsia. And polyphagia, they are eating, always eating, especially in the type 1, where you see they are cachectic, or they've lost a lot of weight. They're trying to gain weight by eating, but the problem is they have glucose in their blood. Whenever they eat, they have glucose in their blood. They take in glucose, but their body cannot utilize this glucose. We talked about it in the first video. Their body cannot utilize this glucose, so they are hungry. They feel very hungry. They lose a lot of weight, but no matter what they eat, it cannot be stored, it cannot be used, it cannot be utilized by their body cells. So they end up being always hungry, always eating, but nothing to show for it. That is the case of type 1 diabetes. So the solution, or this is type 1 diabetes, is the one we call insulin dependent diabetes, because there is a lack of insulin. So let's quickly talk about the cause. These are the symptoms. Let's talk about the causes of type 1 diabetes. Type 1 diabetes is caused by an autoimmune disease, an autoimmune condition that destroys the beta cells of the pancreas. These cells are responsible for producing insulin. So if insulin is absent, or if insulin is lacking in the body cannot make use of the glucose or the carbs you eat, the glucose and everything that is digested from your carbohydrates, the food you eat. So it is like you are swimming in money, but you cannot use it. That's what it means. You're swimming, you have money all around you, but you cannot use it. So it is a very precarious condition. If they are left untreated, they can develop what they call diabetic ketoacidosis, and they might die if they remain untreated. So these patients are usually treated with injections of insulin. So they give them what is lacking to help them, and the recovery is usually dramatic. You see, they've picked up quickly, and they recover speedily, they recover fast. So that is for type 1. We'll go on to the next one, which is type 2. In type 2, the patients still present with these 3 classical features that I mentioned earlier, which is polyphagia, polydipsia, polyuria. Then they might also be obese. I've also mentioned that. Then they can present with sepsis, can present in diabetic coma. Some patients, however, can be asymptomatic, and they won't know that they are diabetic. These patients might come to the clinic, the hospital, for something else, for another checkup, and they are randomly checked. Their sugar level in the blood, or their glucose serum glucose level is checked, and they discover that they might be diabetic. These patients, if they are not lucky, they might present very late, and the late stages, they might already have complications of diabetes mellitus. What are these complications? Complications can be as extreme as blindness. Diabetes mellitus can also affect your kidneys. It can affect your blood vessels. It can affect your nerves, your nervous system. It can cause you foot ulcers in your legs that refuse to heal, no matter how long you treat them. So those can lead to gangrene, and gangrene can often lead to amputation. You might lose your leg or your limb. So these are long-term complications of diabetes mellitus. Let's talk about how do you manage these conditions? What do you do when you're diabetic, or when you begin to see any of these signs at home? You see that you're going to urinate too much. It might not strictly be diabetes that's causing you frequent urination, but it's good to always check up. If you are suspicious, if perhaps your parents or you are related to first-degree relatives that are diabetic, you should always check up on yourself. Do random tests. Go to the hospital. You have relatives, or you're taking care of someone who is diabetic. You should also know about these things that we're talking about today, so you can be able to help them at home, because the diabetics need assistance, they need help, they need care, continual care. They need people to check up on them, to make sure they are taking their medications, to monitor their blood glucose level as well. So what do you do? If you are suspicious of, it's good to get to the hospital, go to a clinic. If any signs, all these signs are picked up, the doctor might recommend what we call the fasting serum glucose test, fasting serum glucose test. Test is called fasting because it is done first thing in the morning before you eat anything. First thing in the morning before you eat. It is assumed that you must have fasted for about 8 hours over the night as you sleep, or over the night. So when you come in the morning, your blood is taken and it is checked. Urinalysis might also be done. Urinalysis is where they take your urine in the morning and analyze it for components. If they find glucose there to a certain level, we might be talking about diabetes. But diabetes is not diagnosed at one test. So that first day of discovery, after the first day of discovery, your doctor might want you to go and come back on another day, preferably the next day, for a repeat test to confirm the diagnosis. It is very, very necessary. No one is diagnosed diabetes on the spot at once, except the person is presenting as an emergency, like diabetic ketoacidosis or diabetic coma. If you're coming like that, it's an emergency. So in those cases, the sugar level or the glucose level in the blood are extremely very high. So the diagnosis can be made on the spot. So this is what you should do when you're suspicious that you might be developing symptoms of diabetes. Get to the clinic, get to the hospital, get tested, and be sure that you're actually diabetic. So for gestational diabetes, it is very important to be able to differentiate if the woman that is this pregnant woman you're looking at is diabetic before or became diabetic after the pregnancy. So it is very important to differentiate, because gestational diabetes can lead to a lot of problems during the pregnancy and during delivery. They can lead to fetal macrosomia, where the fetus is very big, and that might lead to birth difficulty. It may lead to prolonged labor and obstructed labor at the end of the day. They can also lead to neonatal hypoglycemia, where the baby, as soon as it's born, the sugar level falls so low, and if it's not taken care of immediately, the baby can die. You can lose that child on the spot. It can also lead to preeclampsia, eclampsia in the mother. In the case of gestational diabetes, diagnosis is still more or less the same. Two different evaluations of blood sugar levels on separate occasions it's enough to diagnose. So either the fasting blood glucose followed by OGTT, oral glucose tolerance test, where the patient is given about 75 grams of glucose and measured 2 hours after eating. That's 2 hours postprandial. The glucose level is measured to see the level, and the test might also be random, a straightforward at the spot test, random blood glucose. So if your random blood glucose is greater than 11.1 millimole per liter, greater than or equal to that, then we might be dealing with diabetes. If your fasting glucose test is equal to or greater than 7 millimole per liter, we might be talking about diabetes. So these tests are very, very easy to assess in the hospital. They're very, very easy to assess. If you are a diabetic already, it is advisable to have your own glucose testing kit the random glucose test kit is very important for you to have. You should also learn how to use it. Ask your doctor to teach you how to use it. And also those are type 1 sufferers of type 1 diabetes should also learn to inject themselves, or have someone who will inject themselves, will inject them with insulin as on a daily basis. So it is very, very important. Moving on, if you're already diabetic, what do you need to do? Let me talk about type 2 a little. Type 2, they are obese. They're obese, they need to lose weight. The three major things to do if you're diabetic is to 1, lose weight, number 2, exercise, and number 3, diet. You see, these 3 things, they are the cardinal ways to combat diabetes mellitus. Weight loss is very important, especially for workers that are sedentary workers. Sedentary workers are people that sit down a lot, major part of the day. They sit down all through to do their work. So they have to find a way to lose weight. They are not supposed to. It is okay. You might not be able to leave the job, but you should also try to get workouts, or not necessarily workouts, exercises 3 times in a week on average, 3 times in a week, each session lasting from 20 to 30 minutes. It's enough. There are doable things. You can walk, brisk walking, using the stairs rather than using the lifts. All these things, as simple as they sound, can work. And also the dieting, you can also this is where you advise them to minimize the amount of intake of glucose, as well monitor their sugar and balance it up with their drugs. It is very, very important. Your doctor will tell you more. And as important as these two, it is also important. I've talked about exercise, I've talked about weight loss, and I've talked about dieting. It is very, very important. With these, you can avoid the complications of diabetes. You have diabetic nephropathy. That's the kidney, where it starts destroying your kidney. Or diabetes neuropathy. The diabetes neuropathy is when it has started affecting your nerves. You might be stepping on a sharp object with a bare foot and you might not know, because your nervous system is being destroyed. Or it gets to diabetic retinopathy, where you start losing your sight. So it is very important to avoid this. So if you are on medication, your oral hypoglycemic agent, you need to be on these medications. Do not stop on your own. Do not listen to people who will tell you they have this miracle cure and that miracle cure that will cure it without following up with your doctor. Please do not stop your medications by yourself. It is always important you involve your doctor, because your drugs are very important. You know what you're trying to do is to do the work of something that is not there anymore. It's either you're lacking insulin and you're trying to replace it. So how can you decide not to, on a particular day, not to take it at all? So how do you plan to manage your condition that day if you don't take your drugs? So these drugs are very important. Don't say, I'm tired, I've been taking this thing on a daily basis, I'm tired. No, it is not something to be tired of. It's like you are now on manual control. Your body was doing it automatically for years before you developed the problem. Now you have to take the reins. You have to take the steering wheel. You have to do it yourself. So you can't say you are tired. So it is very, very important to stick to your medication. Very, very important. So I hope this video has been helpful to broaden your understanding on diabetes as a whole. I hope if you're diabetic and you're watching this, you've learned one or two things that will help you in your life and also help others. If you're not diabetic, it will go a long way to help you to help others as well. So thank you very much. Give this video a like and share it amongst your friends, and also subscribe if you are new to the channel. Thank you very much. Watch out for more videos. Cheers.